If you're joining us for the first time, maybe you're wondering what SIHI is and what SIHI Talks is all about. We are the Social Innovation in Health Initiative, SIHI for short, pronounced as SIHI, which means upward and forward looking. SIHI is a global network of passionate individuals and institutions who dream of a healthier and more equitable world through social innovation. Since 2014, we have been advancing social innovation in health through research, capacity building, and advocacy. We currently have 13 country research hubs in Africa, Asia, Latin America, and the Caribbean, and Europe. SIHI Talks is a series of monthly webinars that we hold to provide a platform for potential and current partners to connect and find opportunities to collaborate. Welcome! We're glad that you could join another conversation on social innovation today.
All right, so let's get started. Greetings from SIHI, and it's good to see you here with us on Zoom. And we also have people joining us on YouTube and Facebook on SIHI's pages. So my name is Julia from the SIHI Secretariat, and welcome to SIHI Talks. So for today's session, we are going to cover a very relevant and practical topic in the social innovation ecosystem, which is implementation research, which we know is key in generating evidence and support to social innovations in their mainstreaming as well. And we would like to thank SIHI Indonesia, hosted at Gadjah Mada University, for co-hosting the SIHI Talk with us. So to start off our program, may I check if Dr. Riris Ahmad is here with us on Zoom? Dr. Ahmad?
Yes, I'm in. Let me turn on my
All
camera.
right. Yes.
Hi.
So Dr. Riris will be giving our opening remarks. Nice to see you, Doc.
Nice to see you. Hi, everybody.
All right. So Dr.
So
Riris is actually the director, of the Center of Tropical Medicine, Faculty of Medicine at Gadjah Mada University. So Dr. Riris, please take the virtual floor.
Okay, thank you very much. Good evening, everyone. Good morning, good day for those who are in different time zone. Welcome to all SIHI network members who are with us today for this SIHI talk. This is very exciting because this is the first SIHI talk session hosted by SIHI Indonesia, where we aim to broaden the conversation of implementation research beyond its conventional academic boundaries. As a WHO TDR regional training center, Universitas Gadjah Mada has led the way in offering extensive training in research with a strong focus on implementation research. This is also, on the other hand, marks the third anniversary of SIHI Indonesia. Sorry. During this time, we've engaged a wide range of activity from crowdsourcing and documenting innovative solutions to collaborating with local social innovators to enhance healthcare access to vulnerable population. We firmly believe, sorry, I have. Sorry. We firmly believe in the power of research to inform and support social application, enabling those outside the traditional research community to implement innovative solutions effectively. And I'm really privileged to have Dr. Yodi, our dean, my colleague, which will give a valuable insight on how implementation research can be practically applied to those engaging in social innovation at the grassroots level. We anticipate that today's session will be extremely valuable, especially for program implementers and professionals across various nonprofit to grassroots communities, offering a structured approach to applying implementation research strategies in a real world setting. So with no further ado, I think I will give this time to the presenter. Thank you very much.
Thank you, Dr. Ahmad. And yes, We will give a lot of time to Dr. Yodi, and I will have the pleasure of introducing him. So Professor Yodi Mahendradhata, the Dean and Professor at the Faculty of Medicine of Public Health and Nursing at Gadjah Mada University, is a medical doctor by training and is a very well-lauded and well-published health researcher. So please join me in welcoming Dr. Yodi to the virtual floor.
Thank you, Julia. Can you hear me clearly?
Yes, Professor.
Okay, let me share my screen. Okay, so hello everyone. It's my pleasure to be able to share with you briefly an overview of a research strategy for improving implementation of social innovations. But just to set the stage to keep things practical, let me take you to my hometown, Yogyakarta, Indonesia. It's a city which is very well known for its culture, also for its education, but also for a lot of innovations, including social innovation. So I'm just going to give you an example of one social innovations, which was part of our SIHI initiative. It's called Harapan Vian, or in English, it's Vian's Hope. So it's an innovation which is addressing a particular problem where here in Indonesia and perhaps also in other parts of the world, there are people who are living on the streets or in slum areas who often lack formal official ID cards. So they're not registered with the government, with the local authorities. So they're not registered for our universal health insurance. So they have constraints to access the local healthcare service. So we do have a universal healthcare system, but these people would not be able to access that. And the women among them who doesn't have ID cards would not be able to access contraceptive because of the lack of legal proof of marriage. The mothers among them would face difficulties accessing monthly checkup for their babies at the local healthcare center. So the Harapan Vian provides necessary support for mothers and children to access healthcare services, even though they don't have the ID cards or they're not registered. So they organize a monthly antenatal care and well baby examination in slum areas and low-cost flats in our city. They collaborate with the local primary healthcare to offer comprehensive healthcare, and their personal approach, including a home visit, has inspired many other organizations and has been replicated also in different areas. So they're doing quite well, but it's not to say that they don't have any challenges. They are facing implementation challenges. So because they have tailored interventions, it often leaves them overwhelmed because of the high demand and, on the other hand, limited professional staff. Also, the organization struggles to keep up the increasing number of cases because, again, limited number of staff. And they are serving a small, specific group of street dwellers, which gives them challenges in advocating for their impact to stakeholders because it's a small group. And the nature of the group, the beneficiaries moves around, makes it difficult for them to sustain innovation and monitor cases, as many of the individuals relocate, and that leads to interruptions in care. And the repeated relocations also result in recurring financial challenges as they have to restart treatment from the beginning when they relocate. So despite successful healthcare initiative, Harapan Vian face persistent challenges in sustaining and scaling their impact. So there you see there are quite a lot of implementation challenges. And I believe also in many other social innovation initiatives, you will face certain implementation challenges. Now, some of these implementation challenges are quite common. Here are the top 8 implementation challenges from an implementation science perspective. So it could be a challenge in terms of the acceptability of the innovation. It could be a challenge in terms of the adoption. It could be a challenge in terms of appropriateness. It could be a challenge in terms of the feasibility of the innovation. It could be a challenge in terms of the fidelity of the implementation of the innovation. Could be a challenge of the implementation cost. This is what Harapan Vian was facing. Also in terms of coverage, this was also another challenge, and also could be a challenge in terms of sustainability. So these are some of the common ones. There are, of course, other implementation challenges, but these are some of the common ones. Now, this is where implementation research comes in. Implementation research is present to address these kinds of challenges. There are many different definitions of implementation research, but I like this particular way of synthesizing it from WHO TDR, which they say, if you look at the different definitions, in the end, the common interpretation is that implementation research is basically a systemic approach to understand and address barriers to effective and quality implementations of health intervention, strategies, and policies. So the keyword is the barrier to implementation. That's what implementation research is addressing, the barriers to implementation. And the second point is also important there, that IR is demand-driven, meaning that it's not academic driven, that the questions are framed based on the needs identified together with the relevant stakeholders, implementers in the field. So that differentiated with other research strategies. Now, to make it a bit more specific, basically implementation research address implementation bottlenecks, implementation constraints. And by that, it tries to, when it managed to address implementation bottleneck, it tries to identify optimal approaches for a particular setting. And then it promotes the uptake of the implementation research findings, which then is expected to lead to improved healthcare and its delivery. So those are some of the key premises of implementation research. Now, in terms of the type of questions which are posed when you do implementation research, there are a broad spectrum of questions which you can ask. You can frame it based on the challenges. For example, it could be addressing the scaling up challenges of certain innovation. It could be a question based on the sustainability of certain innovation. It could be questions based on how to replicate certain innovations, or how to integrate certain innovations, or how to make innovations more equitable in terms of their impact. Or it could be a question in terms of real-world effectiveness. And of course, there are others, but these are just examples of some of the key research questions which arise from implementation challenges. So that's based on the challenges. Now, you can also formulate the question based on the objective. It could be an exploratory research questions, meaning you don't have much insight yet, so you want to explore the insights. Could be descriptive questions. You want to describe certain phenomena. Could be questions of influence. You want to see the effect of certain intervention, for example, or how it influenced something. Could be explain, trying to explain a certain observation. It could be predict questions, meaning you want to predict how the implementation would be in the future given a certain condition. So these are the different questions, but the key message here is that regardless of which questions, it has to be developed together with the stakeholders or the implementers, so that we are actually addressing questions which is relevant for the implementers. Now, once you have the questions, then you would think of the different variables which would be measured or assessed in the implementation research design. And here are some of the key implementation outcome variables which are often being addressed in different implementation research projects. So sometimes they address the issue of acceptability, adoption, appropriateness, feasibility, fidelity, implementation cost, coverage, sustainability, and so forth. And there you see some of the working definitions of these variables. So these are the main ones. Again, there are, of course, more implementation outcome variables, but these have been the key one. Most of the IR projects which are out there are addressing these variables. And so if you're about to think of an implementation research, perhaps it's useful to start with these variables to see which of these can be the main issues which you are facing in the field in terms of certain social innovations. So you have the questions, you have the variables, and then comes the frameworks, the theories, the frameworks, which you can use to try to unpack that questions and later on to use it to analyze your data. So there are over 100 frameworks, theories, which are employed in different implementation research across the globe. But these 5 are the most common one. You have CFIR, Concept Framework for Implementation Research. You have REAIM, you have NRAN, Stages of Implementation, you have ADAPT ITT, you have WHO ExpandNet. Now, each of these would take quite a while to explain, so I'm just going to unpack the CFIR because that's the one which is most frequently cited among different IR projects. So again, CFIR is a shorthand for Consolidated Framework for Implementation Research. So it's a framework which tries to bring together the different constructs, the different variables, which are mentioned in other frameworks than theories. They try to bring together, consolidated into this framework. And it has been around for quite a while, but it has recently been updated. And this is the most recent version of CFIR, which is out there. And there you see that they try to present to us what are the various constructs which we should consider if we see an implementation challenges. So here you see there are 5 domains. The first domain is, of course, the innovation itself, the thing they call it, the innovation, the social innovation in this context. And in that respect, some of the features of the innovations would influence the success of implementation. So for example, the source of the innovation. Where did the innovation came from? Who brought it in? That would also influence implementation. The evidence base of the innovations. How solid is the evidence behind that innovation? That would also influence the success of implementation. Relative advantage. People would compare. What is the advantage of this social innovation compared to other innovation? And that would influence implementation. Adaptability, how adaptable are certain innovations? Triability, can you try it? Can you actually pilot it first before you go to full scale? Complexity, how simple, how complex is the innovations? The design, the cost, all of that may influence implementations, depends on the certain context. Now that's some of the constructs on the innovation domain. And then that innovations is then through a certain implementation process, which is teaming, assessing needs, assessing contacts, planning, engaging, doing, adapting. Those are also some of the things which would influence implementations from the process domain. So those are also some of the things we can look into if we face certain implementation challenges. And then if we have the individual's domain, you see there are roles, there are barriers and facilitators at the individual levels. I'm not going to throw into the details. You have inner setting. There also you have some interesting constructs there. You have communication, culture, incentive system, mission alignment, access to knowledge, and so forth. And at the end, you have the outer setting, which would also influence implementation through either values and belief, policies and laws, financing, or external pressure. So this is a huge framework because it brings together constructs, variables from many different framework methods, but it doesn't mean you have to look into all of them. It's more of going through them with the stakeholders, with the implementers, which of these might be more relevant to look into, which of these might give you leverage in terms of the intervention, in terms of improving implementation of your innovation. So it could be perhaps the innovations is fine, but there is the problem in implementation process. So that's where you dive in. or perhaps there's a bit of implementation process issue, there's a bit of inner setting issue, there's a bit of outer setting issue. That could also be possible. So it's not trying to go through all of them, but just trying to focus on which of these contracts might be relevant and would be useful to address to improve the implementation of our innovation. So that's an example of a framework which is very popular for implementation research. The nice thing about this framework is that if you're interested, you can throw into the website CFR Guide. They have it there, and it gives you in details for each of those domain, the different constructs and the definitions, which you can think of as working definitions. And then they give you also the detailed description, how do you measure them qualitatively, quantitatively, and so forth. So that's a really fantastic resource if you want to try to learn about CFIR. Go to this particular website. So that's the framework. And once you have the framework, the question is the method, of course, which research method you would use. And in terms of IR, there is no specific particular methods which are for IR. You can use any method as long as it's relevant, it's suitable to address the particular questions that you pose. Having said that, there are some methods which are more commonly used in IR, as you can see here on the slide. So a lot of IR use mixed methods, use participatory action research or quality improvement studies. Some IR used effectiveness implementation hybrid trials. Some use pragmatic trials. The last two, however, is a bit less frequent compared to the top three, which is more common in terms of implementation research in lower and middle income context. But again, these are just a common one. You can use others as long, again, it's appropriate to address the questions. But by far, from our experience of facilitating students and trainees, most of them use mixed method or participatory action research to do their IR, which works quite well. So that's the method. And of course, then you do your data collections, you do your analysis, and then the question is how you disseminate in terms of the result and the recommendations. And here, a little bit different from other research, you don't really think of the dissemination at the end. In terms of IR, you think from the beginning how you would actually disseminate, because it's not an afterthought. You want to think before how you are going to disseminate this, what is the goal, what is the audience, what is the most effective medium, and how you will execute this. Because the end point of IR is, again, to improve implementation, to make change. And this is one of the key way to influence change is try to disseminate it in the most effective way possible. So this is in general terms. But of course, as it is a research, we also would recommend people to publish IR in scientific journals, and there are reporting guidelines for implementation research. This is the standards for reporting implementation studies, which is published in the BMJ. It's to make sure that people report completely and don't miss any essentials component when they report implementation research. So that's the end point when you do your dissemination, you do also your publications. And since we are short of time, just to give you some practical or concrete examples of implementation research, this is one of our students from the Philippines who published an implementation research on acceptability of dengue vaccinations. You can have a look at that. It's open access. This is another one of our students from Nepal who did a study looking at the fidelity of the implementation of a preventive therapy for TB for under 5. This is also open access. You can have a look at that as an example. And this is another example, which is just a couple of months ago, published also in the BMJ Public Health, another one of our students who's looking into the feasibility of innovation, in this case, a NEPA dengue mobile application. And there are many more examples that you can look into in the online journals and so forth. So these are just examples from our programs, but you can just search for the keywords of any of the implementation variables and look into the particular context, be it a particular disease or conditions, and you will find many examples like this. So I hope that gives you an idea of what do we mean by implementation research and how does it look like in practice. If you are interested to learn more in details, there are a lot of resources which has been produced by TDR to help you learn more about implementation research. For example, they have the TDR IR Toolkit, which is available online on this website. You can just download them. It's a self-learning module, which you can learn by yourself. It's online fully. And then also just recently, we have the online courses in implementation research. These are the MOOCs of implementation research, which you can look into the website and you can find different MOOCs which are relevant, which is compiled by TDR. And recently also we collaborate with the other universities which are supported by TDR to develop this foundation of implementation research, which also is a free self-paced online lecture series that you can dive deeper into. And if you really want to go really deep, you can consider enrolling for the postgraduate training fellowship from TDR, which is also accessible for you if you want to take postgraduate training in the 7 universities, which is sponsored by TDR for implementation research. So I think that's it. I think we're in time, and I'm more than happy to take any questions and have any discussions. Over back to Julia for the moderation.
Yes, thank you very much, Professor Yodi. That was a very clear, concise, but very helpful overview of the tools you can use and think about when formulating our implementation research. And now we allocated a bit of much time, or a lot of time actually, for question and answer, and we welcome interaction. So you can use the raise hand function, or you can type your question in the chat. And even if they're not questions, insights are also very much welcome. So our discussion can start now. Maybe I will throw in the first question. So, Professor Yodi, for implementation research, there are many things we can study, right? Like national strategies, policies. But when it comes to social innovation, are there any unique considerations you have when it's implementation research specific on social innovations and health?
Yeah, not in particular, because implementation research itself is pretty much generic for not even just for health. It's also applied for other disciplines, even for law, for education. So even for issues beyond health, they are also adopting implementation research. So it's actually quite a generic approach. The only thing is that there are different paradigms. There are different school of thoughts in implementation research, and some might be more appropriate for others. So, for example, the mainstream which you see, which is in health, is based on evidence-based medicine. That was the root for many of this implementation research, which you see in many of the TDR module or toolkit, for example. But there are other school of thoughts, for example, from the political science. They also do implementation research for policies, which have different frameworks. So the difference is mainly based on the frameworks, the concepts, or the theories, because for particular issues, there are particular theories, particular frameworks, which might be more appropriate or more useful. For example, if you're looking for implementations of large public policy, maybe there are more political aspects which are involved. So many of the frameworks which we had might not give you much help, but there are frameworks, there are theories from the political science which could help you to address the implementation problem, which are more dominated by political issues, for example. So it's more of which theories, which frameworks that you might find useful. But otherwise, I would not think that there are much difference in terms of designing and implementation research for policies or for social innovation.
Thank you very much, Dr. Yu. Okay, so we have a question from Jacqueline Alger from SIHI Honduras. She says, thank you for presenting such a complex topic in a very comprehensive, summarized way. So could you please expand on the trialability aspect of a implementation research strategy?
Yeah. Okay. So the triability of the innovation. Yeah. So you have an innovations and you want to implement that. Now, to what extent that it's well implemented, triability could be a factor, meaning can you try it before you implement it in full scale? So for example, if you say that you want to launch something which is nationwide or if one's district wide, maybe some people are hesitant because there might be a risk of introducing a new innovations. But if you say you can try it in a few health centers, people might say, okay, fine, then the risk is more manageable. So then they might not so be hesitant of adopting it at a more limited scale. So that's a trial ability that you can try it in a limited scale, under control, so less risk. So if you have that, then people are more willing to consider it. It's like if you are considering buying a car, you want to test drive it first. You don't want to just buy it just like that. But if you can try it, then you would consider it more seriously. Okay, I can try it. Then after you try it, then you decide. So that's what we mean by triability.
Thank you, Dr. Yodi. I agree. There's this kind of iterative step that we need to do in implementation research to make sure that one, that it's effective, but also that it will be adapted really by the community. Okay, so now we have actually 3 questions from Beatrice. So she says, very nice and clear presentation, Yoli. Thank you. And could you please elaborate on how SIHI Indonesia supports innovators to embed implementation research in their innovations? What are the successes and the challenges? And is there any examples of synergy between TDR Regional Training Center and SIHI Hub in Indonesia?
Okay, thank you, Beatrice. And yes, there is a synergy because it happens to be managed under one roof. So it's not such an issue because the TDR RTC and the SIHI Hub Indonesia is basically managed under the Center of Tropical Medicine, which is led by Dr. Riris Andano Ahmad, who gave the welcoming address. So in that respect, that it's not so difficult for us to synergize between the two initiatives. Now, in terms of how we embed it, from the beginning, when we launched the SIHI initiatives, we already tried to facilitate them to focus on some implementation issues. Now, we did not actually drive them toward implementation research, but it's more for implementation practice. So these are related. There are implementation research, there are implementation practice. Not everything has to be research. I mean, if some of the issues are actually not so vague in terms of the potential solutions, and you can actually have some ideas already how you do it, perhaps it doesn't have to be research. Perhaps it's just an implementation practice, meaning you can do it without doing research. You can try to use some of the frameworks, some of them just to think through and then work with them through workshops, and then you will be able to actually come up with a certain solutions. That you can do even without doing research, because the research you would actually reserve for things which there are high uncertainties. You don't really know the answers. It's also reserved for more complex implementation challenges. But if you have challenges which are not so complex and you have some ideas, even though not really kind of firm yet, then you can actually try to approach it by just adopting some of the framework, just to think through it and work it out with the stakeholder. And that's what we did with the SIHI institution. The institution that we invite to engage under the SIHI initiative. We did not drive them to do the research, but we did introduce them to the thinking of what are the different implementation challenges and how you could actually go through them. And so that's where we are in terms of it. And yes, I mean, if we go to implementation research, there will be challenges because many of these organizations are not research oriented. They don't have researchers per se. So then they would have to either build a capacity or work with other research institutions. But if it's in terms of improving implementation practice, in terms of using implementation frameworks, that's something which is pretty much doable. But if we do face certain complex implementation challenges and we need to do IR, then we have to think through of building the capacity to do IR and also at the least to work with research institutions like Gadjah, Mada to work with them on an IR instead of just asking them to do the IR by themselves.
Thank you, Dr. Yodi. And I agree, what he presented today are tools we can use in implementation research, but they are also tools that can help us think about community issues. We can use them in other ways, such as the workshops, which many of our CHI hubs use in engaging with their communities and thinking about, well, helping them think about their problems and thinking of the solutions. And I guess, so what makes you decide to do a research or not a research? Or if there's any ethical considerations that you also think about when it comes to IR and IR frameworks?
Yeah, I don't know if you're referring to the last question on the chat about research ethic. Is that what you're alluding to, or is it different?
Yes. Yes.
Yeah. So, okay. So in terms of implementation research, yes, it does. When it comes to research and it involves human subject, it does require ethical approval. Now, the issue is that IR is relatively new, and many ethical committees or IRB, whatever you call it, are not so familiar with IR. So the difficulty is that many of them may not be able to appraise implementation research proposals as they should, because they are using many of the clinical research ethics frameworks that they are used to, for example, to appraise more of clinical trials or clinical research. Well, IR has its own. That's why TDR developed its implementation research ethics course, which are supposedly designed to be able to train ethic committee or IRB board members in implementation research, so that they would be more better position to be able to appraise the ethical issue of IR, because there are some specific issues in IR which might not be of relevance too much on clinical research. On the other way around, there are many also some clinical issues, ethical issues, which are more prevalent in clinical research, but not so relevant to IR. So there's a whole new ethics which is unpacked by IR, and there is also a course on that. So what I'd invite you to have a look into that ethics on IR, which is again underlining that yes, it has some ethical issues. So yes, it requires some ethical approval, but it's a bit different kind of ethical approval that it would require.
Thank you, Dr. Yodi. And I'm reminded that you started as a medical doctor before a researcher. Am I correct?
Sorry? Can you repeat?
That you began as a medical doctor before going into the field of health research. Is that correct?
Yeah, I'm a medical doctor. I'm trained as a medical doctor, but I'm mostly doing public health research now.
And since you mentioned clinical research, I'm just personally curious if sometimes is it difficult to explain to people about social innovation or implementation research in a profession that values clinical evidence-based scientific research?
Yeah, of course there are challenges because there are some aspects, some issues which are different within a clinical context and within the public health context. So there are clinical ethics, for example, but there are also public health ethics, where there are some differences, and there are also some terms, some concepts which are more in public health, which are not well known in clinical domain, for example. So yes, it does. Requires a bit of explanation. But having said that, our clinical colleagues also do implementation research, but in a clinical context. So for example, they face challenges in terms of implementation of evidence-based guideline. I mean, they develop a lot of clinical guidelines which are based on evidence, but then in the implementation, there's a fidelity issue. Sometimes people are not adhering to certain guidelines. So they do also implementation research, but in a clinical context. So the basic idea of implementation research itself is not so difficult to address to them, because they also They also have this, and it's actually rooted on evidence-based medicines approach, EBM. But when you bring it into a public health context or social innovation context, that particular explanation is much more to explain the context, not so much in terms of the IR approach, in terms of the feasibility, acceptability, cost, because that's also known in the clinical field. But when you bring it into the context of social innovation, public health, then yes, that particular context needs quite a lot of explanation for our colleagues from the clinical field.
All right, thank you. And we have a question from Hannah from SIHI Philippines. So thank you for the excellent presentation, Dr. Yodi. For the Harapan FIAM or other social innovations identified in Indonesia, have there been initial outcomes of implementation research, and what frameworks have been used?
Yes, I think I mentioned before that for the social innovations like Harapan Fi and others, we haven't really driven them toward implementation research. It's more toward using the implementation approach, using the method, the framework, but not so much of the research. So we haven't really asked them to do a research per se, but more of thinking of what are the implementation challenges, which I presented on the first two slides. So they were actually thinking that they have, for example, cost issue, sustainability issue, coverage issues. That's the kind of things that came up when they tried to reflect on what are the issues they are facing using the implementation outcome. So that's where we are. We haven't really thought of actually pushing toward a research at this stage, again, because of a capacity issue that we then have to think of resources to build capacity or to link up with certain research institutions. But otherwise, it's more of adopting the implementation approach, the frameworks, the theories to help them think through and work out the solution without actually going into research. And that's actually can be already useful if what you're facing are challenges which is not so complex, and you already have some ideas of what could be the potential factors and solutions.
Thank you, Dr. Yodi. So I'll have a last call for questions from the audience. Please feel free to raise your hand, use the mic, or you can also send in your questions on the chat. So we still have a bit of time for one or two questions. Oh, here we go with Hannah again. So thank you, Dr. Yoli. Are there other barriers to scalability that you have seen that are cross-cutting among the different social innovations the hub has identified so far? And any initial solutions?
Okay. Not so much. So we haven't really looked into all of the innovations together in terms of cross-cutting, as you said. But if you use, for example, the CFIR framework, you could see that there are some things which are relevant for social innovation and so forth. My own favorite is the readiness construct, because many of them, the problem is that they did not really think about readiness when they tried to scale up. So that's one of the things which seems to be a constraint, that you actually need to work to be able to prepare people to actually do implementation. But many are a bit rushing in terms of trying to scale up things, maybe because of the excitement. But there are some details of readiness that you need to work out if you really want to scale things up. So that particular aspect of readiness is often being neglected. Now, this is not something which we've synthesized from different cross-cutting. It's just an observations that when it comes to trying to scale up, many are just thinking about the funding. So they are pretty much focused on, okay, you need funding, you need financial resources, but there are other constructs that you need to think of, and readiness is one of those constructs which is often neglected, because people often think that once you have the funding, you're ready to go. But actually, there are many other aspects of readiness for implementation, which is often overlooked.
Okay, thank you very much. And any last call for questions? And what I appreciated from what Dr. Yodi said, no, although our topic today is research, it's also important to think of the capacity with the communities we are conducting our research or these implementation workshops or initiatives, and also the advocacy aspect that we have to think of the dissemination strategy of what we are doing first and who it is for. And it's not just for the research and the evidence, but it is an engaged process to do implementation research. Okay, so any last call? All right, so thank you very much. Oops. Okay, one last. Okay, so from Mr. Muhammad, I would like to ask, how would you communicate with stakeholders, especially government agencies? That's an important question in
That is an
aligning with their
important question.
agenda.
Yeah. It also depends
Yes.
on which level of government that you are dealing with. I mean, there are implementation issues which could be addressed at the national level. It could be a provincial or state level. It could be a district level. If you're a decentralized setting, there are different level of governments, and each of those would have different ways to approach. So it's not easy to do that, to be able to work with the government. But one thing is for sure, what we learn is that trust really matters. So they would work with you, and it's easier to communicate if you have their trust, and that requires relationship building. So it's not something that you can expect to happen overnight, that you have a nice IR result and you come over them and you communicate with when you're expecting to adopt tomorrow morning or next Monday. But you really need to build the relationship with the governments long before that. So ideally, I mean, the situation we have here in Gadjah Mada, for example, we have decades of relations with local, provincial, national governments. And so when we have some needs, it's not so difficult for us to approach them because they know us, we know them, we know the people, there are some trust. So it's not so difficult for us to communicate. And that doesn't mean that they always listen, but it's not so difficult to invite them, or the other way around for us also to go there to be invited in their meetings. So you need to invest on that way before you do your research. You need to invest on relationships because that would have impacts on the trust level that they have, and that would impact on how effective your communication would be with the government, because sometimes it's not just the song, but also the singer. It's not just about the evidence, but who's actually delivering the evidence. Is it someone that they were willing to listen to? Is it someone who's trustworthy to them? So that has been one of the key lessons that we have in terms of working with government agencies. Over to you, Julia.
Thank you, Dr. Yodi. And I think that was a very good question and response to end our Q&A discussion. So thank you very much, Professor Yodi, for your lecture. It was very, very informative. And to all our audiences, we'll have the recording up on the SIHI pages so you can look back on them. And without further ado, to close our program, may I call on Beatrice Salpap, the co-founder of SIHI.
Thank you, Julia. You can hear me well?
Yes.
Yeah, so congratulations, Yodi, congratulations for this really clear and nice presentation, demystifying a bit of what is research in social innovation. So this has been very well received. Thank you to you. Thank you to the SIHI Indonesia Hub and to the SIHI Philippines for this amazing event. I think it's very stimulating discussions as well. And a big thanks also to Julia for having done a great facilitation. So it's a pleasure for TDR to actually see, you know, like how the work of the SIHI hub in Indonesia synergize, like Yodi mentioned, together with the regional training center, the TDR regional training center that is hosted there. And indeed, it's a great opportunity to bring all those tools and experience in training, so training tools and experience from the regional training centers into the CI Hub, and as well through all the collaboration that you have with all the SIHI hubs like SIHI Philippines and SIHI China and others, is a great opportunity to really strengthen this research part. And indeed, the innovators are not researchers, and this is why they need actually the academic sector to work with them, democratizing research, demystifying research, just explaining. And I actually very much appreciate also this difference you stated between the implementation research and implementation practice, and it makes a lot of sense to first get individuals sensitized. So it's quite interesting, and of course then moving towards the multidisciplinary, multisectoral, participatory action research. So it was a very nice discussion, and I'm really looking forward to actually have lots of interaction and seeing how best we can embed research and embed implementation practice into social innovation and showcase a little bit the value of research to enable social innovation to be more effective, to sustain, and to scale up or replicate depending on their situation. So again, thanks to all, thanks to all the audience. It's an event that has many participants today, so lots of interest. And on the behalf of TDR, thank you everyone. Over, Julie.
Thank you as well, Beatrice. It's nice to see you, and thank you for those very nice words. And again, thank you all for being here. We hope you've learned very relevant learnings to your work and to social innovation. And we hope together we can transform health systems through research, advocacy, and capacity strengthening. And we also have a survey if you'd like to receive a certificate of attendance. And please stay tuned to SIHI's pages on Facebook, YouTube, and LinkedIn for schedules of our upcoming SIHI Talks. So thank you all very much, and have a good night, a good day, or from wherever you are. Thank you, and have a nice time.
Okay. Thank you,
Thank
everyone.
you.
Thank you,
Bye.
Julia. Thank you, Beatrice, Meredith.
Thank you, Dr. Yodi.
Thank you, Dr. Ahmad. And also thank you everyone for coming tonight.